Hello and welcome to CoronaNomics, brought to you by Econ Films. This week, merging economics and epidemiology. The crisis is a health crisis, but also an economic one. At the start of the year, macroeconomics and epidemiology felt like two separate disciplines, with distinct models, run and analysed by different sets of people. This meant policymakers often felt they weren't getting the kind of advice that enabled them to properly weigh up lives with livelihoods, or to see the big picture. But this is changing. Economists and epidemiologists are now working together, merging their models and creating the new discipline called epi-macro. But how will it work? And will governments listen to the results? I'm Ben Chu, economics editor of The Independent.
And I'm Lizzie Burden, economics reporter at The Telegraph. We'll be your guides, and if you like what we're doing, please hit the subscribe button as it helps people find us. Joining us this week is epidemiologist Neil Ferguson, professor at Imperial College London and former member of SAGE, the expert committee that guides the British government on the science behind its pandemic response. It was his modelling this year that many attribute to a sharp change of UK policy towards a total lockdown. We're also joined by Sir Tim Besley, one of Britain's most influential economists in policy circles. Based at the London School of Economics, he's part of the DELVE initiative, bringing together scientists of different disciplines to share approaches to the pandemic. He's recently made a documentary for the Economics Observatory looking at how economics and epidemiology are combining. Welcome to CoronaNomics.
Now, Neil Ferguson, first of all, as Lizzie said in the introduction, many credit your epidemiological model on the 16th of March, which showed a pretty terrifying surge of deaths from the pandemic without drastic measures to restrict human interactions, with effectively bringing on the lockdown by the government on the 23rd of March. That model showed, I think, about 510,000 deaths in the UK if the restrictions weren't imposed, as we can see from this chart now. And the green line shows the American unmitigated spread of the disease with about 2.2 million there. Now, in the UK, we've actually had between 40,000 and 50,000 deaths since March. Now, my question is, when you were putting that model together, you and your team, were you considering the impact of a lockdown on livelihoods at all? Or were you focused primarily on the immediate health question? And do you wish as well that you had the tools at that time to integrate perhaps secondary economic impacts on health as well?
Interesting question. That report really focused on comparing two scenarios. I mean, the totally unmitigated scenario was never viewed by us as being likely. It compared following a mitigation scenario, which is typically what has been done in past pandemics and past infectious disease, where we don't try and stop something. We just do our best to protect people, shield the elderly, but let the epidemic run through the population, and looked at the consequences of that. And the relevant number for the UK was more like 250,000 deaths in that scenario, and compared it with then what we call suppression. And I should say suppression just means controlling transmission. Sweden also achieved suppression, albeit without a lockdown. And that gives much lower numbers of deaths, because basically you're not allowing the epidemic to really run through the population, you're controlling spread. As for economic considerations, we were always very conscious of the likely economic impact of any suppression measures which involve large-scale social distancing. And they were the topic of much discussion within the SAGE committee you referred to. Were one of the reasons, indeed, why perhaps the UK hesitated longer than some other countries in even adopting these measures. That, and I should say, a long-term perspective, which is we anticipated exactly where we'd be now, that lockdown was never going to be a long-term solution. And as soon as you relax those measures, the models will predict and reality has shown, you see a resurgence of transmission.
But just to be clear, there was no economic effects actually in the model itself that you presented?
No, we are epidemiologists. Whilst the centre I run includes economists, we weren't attempting to model economic impacts. That's not why I was advising the government.
Now, let me turn to you, Sir Tim. How do you think that initial government policy back in March might have been different if it had been guided by an epi-macro rather than merely a purely macroeconomic or purely epidemiological analysis. Is it possible that it might have led to a less restrictive Sweden-style approach, or perhaps even a more hardline Chinese style?
Well, I think there's a simplistic view that I want to dismiss, which is that somehow, had there not been a series of measures put in place, that the economy would not have been responding rather negatively to the COVID epidemic. I mean, many of the effects of an epidemic of this scale are driven by people's behavior in response to the epidemic. And if you actually look in the data, you'll see that people had stopped mingling in certain places well before the lockdown happened in March 23rd. So, and if you look at Sweden, I mean, the economy there has also responded negatively to the epidemic. So, I think this idea that you could have had an outcome in the face of such a health emergency that wouldn't have had a serious economic effect, I think needs to be set to one side. Then there's a sort of fine-tuning element. Could it have been done at lower economic cost? Well, to be honest with you, I don't think any of the models that we have in economics can be used at this moment to fine-tune based on the kind of information and knowledge we had. Now, you can grumble with very specific measures that were taken, that, you know, this is a big learning experience, and in retrospect, I'm sure we would have gone back and rethought things, but I don't see that had one had economic projections based on some of the measures that were taken, that things would have been dramatically different. I think where it's much more useful to start putting economics into the equation is when you get down to the specifics of detailed policies. In particular, you know, if you want to reopen sectors or close down specific lines of the economy, then what are the implications of that, and what are the mitigation measures that could be taken, and at what economic cost? So I don't see this particularly as a big macroeconomic gamble that could have been forestalled by some different macroeconomic management system. It's much more down into the details of the policies that are undertaken.
And we're trying to do that right now, I should say. We're building with economists integrated models which asks, subject to an overall constraint, you want to keep the reproduction number below 1 or stop hospitals being overwhelmed. What's the economically optimal way of doing that in terms of sector by sector measures? The challenge is that we don't really have the right data and the accurate enough data to really be confident in the results as yet.
Professor Ferguson, let me just sort of go back a little bit to what Sir Tim was saying, that there was this reaction from people before the lockdown, that effectively people were already curbing their interactions. If you'd have known in March that fear of catching disease would lead to people acting in that way, how would you have thought about that and incorporated that effect?
So there's been a lot of, first of all, we did think about it. Our knowledge of how populations respond in terms of spontaneous behaviour is not detailed enough and quantitative enough to actually incorporate within models with any reliability at the moment. It's really the week before lockdown where you saw the biggest, you could say, spontaneous changes, but there was very strong government messaging on the 16th of March that people should avoid, you know, bars, restaurants and mixing. And so you could argue that what you were actually seeing is response to a policy intervention, not just completely spontaneous behaviour. The 510,000 deaths was never a likely scenario. We always anticipated there would be a spontaneous response. But I don't think behavioural science is at a stage where we can accurately predict, you know, how large that response would be, and therefore rely on it to, in some sense, save healthcare, you know, save the healthcare system.
So Tim, you mentioned the idea of a trade-off between the economy and health. I want to play us a clip from the Chancellor Rishi Sunak in September.
We have so often spoken about this virus in terms of lives lost. But the price our country is paying is wider than that. The government has done much to mitigate the effects of these awful trade-offs between health, education, and employment. And as we think about the next few weeks and months, we need to bear all of those costs in mind.
So where lots of backbench Conservative MPs are saying that the economy is being sacrificed for health, and you know it's a small proportion of the population who are much older, it's inevitable that there'll be a trade-off between health and wealth, right?
I mean, at some meta level, it's right to think that there is, but I think it's not a very good way of approaching policy for a couple of reasons. First of all, the impact both on health and on the economy falls on very specific groups. And without bearing in mind whose livelihoods are being affected and whose health is being affected, one doesn't really get to the nub of the kinds of interventions you might do to protect different groups. So in the case of the economy, in particular, many of us are concerned, of course, that the large economic burden is falling on the most disadvantaged groups. So it's quite right that policy would be responding specifically to those concerns rather than the generalized economic effect. So when you look at GDP, that's falling on different people in different ways. It's not going to be a particularly good guide to the way the economic costs are being distributed. I personally don't think there's what you might call a purely scientific approach to making those trade-offs. Those of us who have any expertise and can help guide the process, our job is to make sure that those decisions are as informed as possible. But I don't think you can get away now from the fact that it is the job of politicians to look at the evidence and to own the strategy, not to hide behind experts and say we're only doing this because this or that expert told us to, but actually we've weighed it up. We as your representatives are going to stand behind X or Y. And I think that's the right way to approach what in the end will involve some gainers and some losers of different kinds, but at least it's going to be arrived at in a properly reasoned and joined up way.
Neil Ferguson, do you agree that epi-macro is not about denying there's a trade-off between health and wealth, but mitigating and navigating a path that has the best balance?
Yes, absolutely. I mean, I think there's a lot of false dichotomies out there in the media, apparently simple solutions, for instance, shielding the elderly, letting the epidemic run through the population, where a lot of work was done on that all the way back in February, March, and then through April, May to see how feasible it would be. And it just turns out it isn't really feasible. We can see that today, that, I mean, you can't decouple a large section of the population from the rest of the population, particularly if the most vulnerable people depend upon social care services and residential care services provided by actually low-paid younger people. I suppose the overarching constraint we all have to live with is that we need a functioning healthcare system. We cannot allow this virus to overwhelm, the NHS in this country. And I think with that overall constraint in mind, then there is a lot of political judgment involved and balances and trade-offs between the economic costs of policies and their impacts on transmission.
I want to take a look at a clip from the UK government's chief scientific advisor, Sir Patrick Vallance, who was speaking to Sir Tim Besley's in his documentary for the Economics Observatory website.
What we now need to think about is what would we do to try to take advantage of what we've learned and integrate both science and economics as combined evidence information for policy and decision making. And I think that is something that is really worth going after as a goal.
Neil Ferguson, you're not a member of SAGE at the moment, which is the committee that Sir Patrick Vallance chairs, of course, advising the government on the science which guides their policy response. But presumably you still speak to people who are involved. How much do you think are they considering bringing in economics into their modelling?
SAGE from the outset had and has always had a behavioural science subgroup, though economics is not well represented on that. I mean, I think overall in this epidemic, there has been quite a lot of input which has been joint. I mean, we have engaged with Treasury quite a lot, people in the centre I lead, and had a lot of joint discussions with Cabinet Office and Treasury involving both economists and epidemiologists. So it's not like these issues haven't been addressed. I think the challenge is building this sort of science from the ground up in the middle of a crisis. Epidemiological models and mathematical, econometric, or even macroeconomic models share a lot of mathematical foundations. But I don't think we're going to be in a position of having a mature enough discipline for this to really guide policy during this epidemic. I think it is something for the future.
And Sir Tim, it's been reported that the Chancellor wants to put economic data out pretty much alongside daily health data on cases and hospital admissions and deaths in order to emphasize the short-term economic consequences of restrictions or new restrictions. What's your view on that idea?
Well, I think the devil is very much in the detail. If you're putting out data that helps to meaningfully guide both individual and collective thinking on what the right steps are, then of course I'm all in favor of it. So it would depend which particular statistics are being brought out and how they're being presented and interpreted. I do think it would be to the benefit of us as citizens to be more exposed, of course, to that. But one example would be to what extent one is using it to illustrate patterns of who the gainers and who the losers are from particular measures. I think if someone was just showing me a GDP chart going in some negative direction, I don't think that would be very helpful at all. Any more than I just see a picture of deaths or infections going in some direction.
But haven't you put your finger there on perhaps one of the challenges of this epi-macro project, which is that the daily growth in cases and deaths tells us something about the immediate progression of the disease, whereas macro data by its nature is much less frequent, much less reliable, much more prone to revision. Is there a challenge there in that the pace of change is just very different on when you're measuring a disease and when you're measuring an overall economy?
Well, I think you raise a bigger challenge, which is the right time horizon over which to be judging this. When you speak, as I do occasionally, to people in Sweden, I think one of their arguments is they're taking a more long-term view than they believe some of the governments of other countries have been taking. And I think one of the weaknesses in communication in general among policymakers has been not to describe what you might call a medium-term perspective on this. And one thing actually the models are very good on are giving you a sense about what would happen sometimes if you release the economy too early or hold it down too late, because in the end, you might be able to have some short-term benefit, but it's going to be at some longer-term cost. So it's absolutely essential you don't just focus on somebody published a GDP number last week and that's going to drive us in direction X or Y. No serious macroeconomic forecasting or policy would be based on a single quarter.
Yeah. And Neil Ferguson, I suppose the opposite applies to some degree in epidemiology and disease control. The danger is an underreacting to data. Is that not correct?
Knowing how quickly epidemics are moving is critical to decisions around introduction of interventions and what those interventions are. I mean, one of the challenges we faced back in March was only having a relatively poor handle on how quickly the epidemic was spreading in the UK, and particularly how many people have already been infected, which is one of the reasons why, once hospital data came through from the 13th of March onwards, policy evolved very quickly at that point when it was completely apparent that the health system would be overwhelmed within a month or two if something drastic wasn't actually achieved. I think, as Tim said, I mean, epidemiological models have quite a long history of being used for not quite forecasting, but scenario analysis long term. And so the situation we find ourselves in now of rapidly increasing incidence across Europe was exactly anticipated, not just by my model, but by all models. I mean, it's a natural consequence of the dynamics of the epidemic and the impacts of controls and then lifting those controls. What we couldn't do, which we would like to be able to do, but was impossible given the data we have available, is predict exactly what combination of interventions would achieve control. What's the minimally economically disruptive combination of interventions which would achieve control? And I think all countries are learning that as they go along, including Sweden, I should say, which is currently intensifying controls.
And just to go back to March again, the government at that time was insisting that they were following the science all the time. Since then, we know that SAGE has recommended a 2-week circuit breaker lockdown. That's not been taken up by the government. Can they still claim to be following the science, do you think?
The measures which have been introduced, at least in recent weeks, have been to a large degree evidence-based. I, like many other people, including Patrick Vallance and Chris Whitty, are not convinced at the moment that they're sufficient to achieve control of spread. And that was a political judgment made by the government to, in some sense, introduce a certain set of measures, see whether they worked, and then probably eventually escalate those measures if they didn't work. I mean, but that's the role of politicians.
Another headline UK policy was the Chancellor's Eat Out to Help Out scheme, which gave British diners half-price meals at restaurants on Mondays, Tuesdays and Wednesdays throughout August. As we can see, it was launched amid much fanfare and it was highly popular, but many are saying that the UK's second wave of cases shows it was a mistake. They argue it spread the virus for no sustainable economic gain. So Tim, is that the sort of policy that epi-macro would advise against?
Certainly some of my colleagues were sceptical right from the start about the policy, given what you might call the economic benefit for the increase in risk. But what I haven't seen is any convincing analysis that it was a material factor in the pickup of the disease in recent weeks. I don't think it's completely obvious. There's been a whole range of factors, I think, in the past weeks that have led to people perhaps engaging in riskier behaviors. My hunch would be, but I stand to be corrected, that it's probably around the margins, the impact of people visiting restaurants a little bit more often in August. But as I say, Neil may know better than me on that, having seen some analysis.
The 10 p.m. curfew on bars and restaurants in England and local lockdowns, how do all of these and Eat Out to Help Out fit with epi-macro principles?
So first of all, I would agree with Tim that I haven't seen any convincing evidence that Eat Out to Help Out made any appreciable difference to risk. Undoubtedly, reopening the economy, allowing people to go to restaurants and bars has contributed, as well as more general, more frequent mixing of people in society, to the growth of the epidemic we see here. I mean, the UK is not in a unique position. The whole of Europe is experiencing the same challenges right now. So I think it's very hard to attribute and probably misleading to attribute those risks to particular policies, and we don't have that granularity of data. I think in terms of targeted measures, we're seeing, again, across Europe, a whole plethora of different measures, which to some degree have a basis in science. So we do know from what are called case control studies conducted both here in the United States, elsewhere, I think, that mixing indoors in hospitality venues, particularly in bars, has some higher risk of transmission. Whether a curfew is going to reduce that risk is not something we can really make a judgment based on scientific evidence. We just don't have the data available.
I just want to pick up something with you, Sir Tim. Neil Ferguson said that he didn't think epi-macro would probably be in a position to be quite ready to influence policy making in the coming months. Do you share that view, and what sort of timescale do you think that we might start to see epi-macro making serious contributions to policymakers' actions?
I do think we're making progress. I think one of the big barriers, and to some extent Neil touched on this just now, is getting the kind of data that you need to do serious policy analysis that brings together what we need to understand so that we can fit it together with models of the disease progression along with economic costs, where I do think we will be making progress, hopefully over a time horizon, to inform policy. And that's the impact of different physical distancing measures on business. We know that's been, I think, quite rightly, something that's been done to try and mitigate the impact of the disease, but we don't really know what the economic cost of that is, because we didn't really have the kind of data you need to analyze that. But the more we get a sense of how physical distancing measures in the workplace can halt disease transmission, and it's people like Neil and his colleagues who can advise economists on that, and we join that together with data on how business costs are affected by that, we could then begin to get into a much more granular kind of policy that allows us to support those businesses according to the size of the economic shock that they faced. And so I think over the horizon, the next few months, I think we'll get more and more studies, albeit still quite preliminary though, that are the product of the fact that, since March, quite a number of people have switched their research agendas to try and understand that interplay between the factors that lead to the progression of the virus and those things that impose economic cost, to a point where policy can improve. So with the intensity of effort that's going on, and the collection of data and the increased knowledge of how transmission works, we will get to a better place, and therefore the policy advice will follow from that.
We don't need any lessons in the power of models after the year we've had. But we've had a great discussion and an incredibly exciting and important area. So thanks so much to Professor Neil Ferguson and Sir Tim Besley for appearing on CoronaNomics.
We'll be talking to many more top thinkers in the weeks ahead to discuss how we can weather the economic storm of COVID-19. So please do stay tuned and subscribe to our YouTube channel.
And remember, if you like what we're doing, please hit like and subscribe.
And if you'd like to talk to us, just leave us a comment below.
This has been CoronaNomics, brought to you by Econ Films.